Welcome to the Provider Enrollment Application Training. The purpose of this training is to provide guidance in completing the required documentation for your Medicaid home and community-based waiver services provider application. We will review required application documents for independent providers and include documents specific to personal care aide, home care attendant, and nurse applications. At the end of the presentation, instructions to the online application portal will be included, with references to assist you in completing your application. Let's review the three types of independent providers: personal care aide, home care attendant, and nurse. Personal care aides assist activities of daily living and instrumental activities of daily living. Examples of activities of daily living include bathing, dressing, and grooming. Instrumental activities of daily living include general homemaking activities, paying bills, accompanying or transporting to appointments and errands, and assistance with correspondence. Please note that this list does not include all personal care services, and more information can be found in Ohio Administrative Code 5160-46-4 at codes.ohio.gov. Personal care aides use provider type 25 and specialty 250 to complete an application. Home care attendants are supervised by an RN. They can assist with self-administration of medication and skilled nursing tasks such as tube feeding and ventilator care. Home care attendants may also provide personal care services. Guidelines for assistance with self-administration of medication and nursing tasks are available in Ohio Administrative Code 5160-44-27 at codes.ohio.gov. Home care attendants use provider type 26 and specialty 260. Nurses may provide waiver nursing services, including administering medication, and are not prohibited from providing personal care aide services. An RN is required to perform some nursing tasks, and these are listed in Ohio Administrative Code 5160-44-22 at codes.ohio.gov. Nurses use provider type 38, RNs will use specialty 381, and LPNs will use specialty 383. Now that we have covered the types of services each independent provider type can perform, we're going to look at general application tips and required documents for all independent provider applications. Let's review some helpful information for independent providers. These are items that often require corrections and could delay the processing of your application. It is our hope that by reviewing these common application errors here, you will avoid delays and your application will move quickly through the enrollment process. The provider application will ask if you have previously participated as a Medicaid provider. If the answer to that question is yes, be sure to include your provider ID number on this application question. Be certain to report any violations of state or federal law to ensure the information on the application is complete and accurate. The name listed on page 1 of your application needs to match the legal entity name entered later in the application because you are an independent provider. The name listed on all application documents needs to match the name listed on your application. You will have to submit a document of name change if there are any discrepancies between the name on your application and the name on your application documents. This typically occurs when a last name has changed. However, you will have to submit the document for any change in your name between your documents and the application. Acceptable documentation for a name change can include a birth certificate, marriage certificate, divorce decree, or a legal name change. Your document will need a seal, notary, or court stamp to indicate an official document. Because you are an independent provider, your tax ID is your Social Security number. Additionally, when you sign the application with an electronic signature, be sure you sign your name exactly as you entered it on page 1 of your application, and select the ownership type that reflects you are self-employed with a sole proprietorship. Next, let's review the documents which are required for all independent or non-agency provider applications. A government-issued photo ID is required. This document needs to be current, not expired, with a clear photo and name that matches your application. A copy of your Social Security card is required. The card needs to be clear and easy to read. The name on the card will need to match your application and W-9 form. The number on the card must match the number on your application and W-9 form. You will also need a completed W-9 form that has your name and Social Security number exactly as written on your application, photo ID, and Social Security card. The form must be signed and dated within the last 12 months. Your name is entered in Section 1 of the W-9 form. Section 3 matches your ownership type for individual sole proprietorship. Section 5 and 6 require the address information that matches your application. Your Social Security number is entered in Part 1 of the W-9 form. Part 2 is where you would sign and date your form. The EVV, Electronic Visit Verification Training Certificate, is required as part of your application. EVV is required to bill for services once you are enrolled as a provider. The name you enter when registering for EVV training must match the name on your application, as this information will be printed on your EVV training certificate. A National Provider Identifier Number, NPI, is required to enroll as a provider. The name on the NPI needs to match the name on your application. This number is required to bill for services. You can apply for an NPI number at nppes.cms.hhs.gov by selecting NPPES Web Applications. A background check is required to complete your application. Please inform the web check location to have your results mailed directly to ODM at BCI Coordinator, P.O. Box 183017, Columbus, Ohio 43218. The web check location will ask for the fingerprint reason for the background check. Tell them the reason is independent provider for home and community-based waiver services with reason code 5164.341. An incorrect reason code could require a new background check to process your application. An FBI check is required if you have not lived in Ohio for the past 5 years or more. Use reason code 3701.881 for the FBI check. You can find a web check vendor to complete prints for your background check in the supplementary materials for this training at ohiohcbs.pcgus.com under the Enrollment tab. As a review, all independent providers require the following documents: a photo ID, Social Security card, W-9, EVV training certificate, NPI number, and a background check. If you have not been an Ohio resident for at least 5 years, you will also need an FBI check. Now that we have reviewed documents for independent provider applications, we will review additional documents specific to personal care aid applications. Personal care aides must submit a document of training. All training must be completed within the last 24 months, and the training documents you submit must clearly show the date your training was completed. Required training topics include personal care services, basic home safety, and universal precautions. The Ohio Administrative Code lists 3 options to meet the training requirements at codes.ohio.gov. The first option to meet the training requirement is to complete a competency evaluation or a training and competency evaluation program approved by the Ohio Department of Health. An example of this training document is a state-tested nurse aide STNA number in good standing with the Department of Health. Verify your status in the Ohio State Tested Nurse Aide Registry at nurseaideregistry.odh.ohio.gov/public/public nurse aide search. Other examples of a training document using this training option are an STNA training program certificate that does not include testing for an STNA number with the Department of Health, or a home health aide certificate from a training program approved by the Department of Health. A second training option is a Medicare Competency Evaluation Program for home health aides. Documentation for this training option includes a certificate and a skills checklist verifying you have completed 75 hours of training. 42 CFR 484.80 outlines the requirements for this training option. The last training option is the Other Equivalent Training Program. Other Equivalent Training allows you to meet your training requirements by working with a provider, individual's authorized representative, or individual's family member to complete training and create a training document. The document must include training completed in personal care aid services, basic home safety, and universal precautions. The training document you submit must verify you are the person receiving training, the training complete date, and the trainer's name and signature. Your personal care aid application requires that you obtain first aid certification. If you have already completed a first aid training program, verify your certification is current. Certifications must be from a class that is not solely internet-based and that includes hands-on training by a certified first aid instructor and includes a successful return demonstration. The name on your certification needs to match the name listed on your application. As a review, these are the required documents for all personal care aid applications. A training document that meets the Ohio Administrative Code requirements, and a first aid certification. Now, we will look at additional documents needed to complete the home care attendant application for independent providers. These are in addition to the documents required for the independent provider application that include a photo ID, Social Security card, W-9 form, EVV training, background check, and Ohio residency. If you are applying as a home care attendant, you will need current first aid and CPR certifications. Certifications must be from a class that is not solely internet-based, and that includes hands-on training by a certified first aid instructor and includes a successful return demonstration. The name listed on these certifications needs to match your application. You will need a training document dated in the last 24 months. There are 4 options listed in the Ohio Administrative Code 5160-44-27 to meet the training requirement. Let's look at examples of the training document requirements in more detail. The first option for home care attendant training documentation is to be state-tested nurse aide certified. A second training option is a Medicare Competency Evaluation Program for home health aides. Documentation for this training type includes a certificate and a skills checklist verifying you have completed 75 hours of training. 42 CFR 484.80 outlines the requirements for this training option. The third option for training documentation is a certified vocational program in a healthcare field with written testing and skills testing by return demonstration. This option requires a certificate and transcript for the program completed. The last option is to create your own document. You can submit a written attestation of training, instruction, and as appropriate, skills testing by return demonstration. When you create a training document, include your name listed as the person trained, the date the training was completed in the last 24 months, the name of the trainer, and the trainer's signature. The required training topics are listed on the next 3 slides. These are the required training topics for the option using the written attestation of the training, instruction, and skills testing by return demonstration. Personal care services such as bathing, dressing, transferring, etc. The maintenance of a clean, safe, and healthy environment. Meal preparation, including special diet preparation. The physical, emotional, and developmental needs of individuals. Universal precautions for the prevention of disease transmission. Basic elements of body functioning and changes in body function. Basic safety requirements and knowledge of emergency procedures. Reading and recording temperature, pulse, and respiration. Observation, reporting, and documentation of individual status and services provided. Communication skills, including the ability to read, write, and make brief and accurate oral or written reports. Next, we will look at the home care attendant forms in more detail. These are additional forms documenting training for home care attendants in skilled nursing tasks and assistance in self-administration of medication. This is page 1 of the Skilled Task Authorization form. Information for the individual receiving home care attendant services is entered at the top of the form. The bottom portion of the form is where tasks you will perform are listed. The authorizing healthcare professional, or AHP, must initial after each task to confirm you have been trained. Before submitting your documents, confirm the individual's information is complete and the authorizing healthcare professional has initialed each task included in your training. Moving on to page 2 of the Skilled Task Authorization, the individual or authorized representative completes the first part of page 2. You complete the next section of the form with your printed name, signature, initials, and the date the form was signed. The trainer completes the next section. The trainer could be the individual, the authorized representative, another provider, or the authorized healthcare professional. The authorized healthcare professional section is completed by the person that initialed your training tasks on page 1 of the Skilled Task Authorization. This person is usually an RN. This could also be a physician. This section includes the emergency phone number to contact the healthcare professional and a fax number if one is available. If there is no fax number available, NA may be listed in this field. There is a space at the bottom of the form for the individual or authorized representative to initial the form, and the authorizing healthcare professional also needs to initial the form. The sections with initials are easy to miss, and you will save time processing your application by confirming you have the initials where required. Before submitting your documents, confirm the printed names, signatures, dates, and initials are filled in for required fields. Page 3 is the last page of the Skilled Task Authorization form. Use as many copies of page 3 as needed to record all of your tasks. The effective dates for the Skilled Task training are listed in the upper right section of the form. These dates cannot exceed 12 months. Please ensure the start and end dates do not exceed 12 months. The name of the task on page 3 should match the tasks listed on page 1. Training details are required on page 3 for each task listed on page 1 to complete your Skilled Task Authorization. The field at the bottom of the form requires the authorizing healthcare professional's initials. If multiple copies of page 3 are needed, each additional page needs to be complete and include the initials. Before submitting your forms, confirm the individual and trainer's names are listed at the top of the form. The effective dates do not exceed 12 months. The training date is filled in, and the authorizing healthcare professional has listed initials at the bottom of the form. New copies of the forms are required after 12 months, with the original forms and future forms and updates maintained in the individual and provider files. The next form we will look at is the Home Care Attendant Medication Authorization Form. Page 1 of the Medication Authorization is very similar to page 2 of the Skilled Tasks Authorization. Your information will be listed in the Home Care Attendant section of the form. Before submitting your form, confirm all printed names, signatures, initials, and dates are complete. There are also 2 fields at the bottom of the form for the individual or authorized representative and the authorizing healthcare professional to initial the form. On page 2 of the Medication Authorization lists the medications you will assist the individual in self-administering. Before submitting your form, check to confirm all start dates for medications are listed along with dosage, how the medication is administered, how frequently, and common adverse reactions. You and the trainer need to initial each line with medication information when you have been trained. Copies of these forms are also available on medicaid.ohio.gov under Resources for Providers, Enrollment and Support, and Provider Enrollment. The Documents section on the right side of the page has links to these forms. In review, to submit your home care attendant application, you will need first aid certification, CPR certification, a training document meeting the guidelines in the Ohio Administrative Code, a completed home care attendant skilled task authorization form, and/or a home care attendant medication authorization form, depending on the waiver participant's needs. Next, we will look at the additional documentation required to complete an application for nursing services. Nurses are required to have an active and unrestricted nursing license with the Ohio Board of Nursing. The name listed on your license needs to match the name on your provider application. To review, nurses require an active and unrestricted license with the Ohio Board of Nursing to enroll as a nurse. Next, we will review how to start an enrollment application to become a provider. Before starting your application, you will need to create an Ohio ID. To create your Ohio ID, visit ohid.ohio.gov/wps/portal/gov/ohid/login and select Create Account. Follow the prompts in the Ohio ID system to create your Ohio ID. Once you have created your Ohio ID, you can log into Provider Network Manager, which is the provider enrollment system. All enrollment applications are submitted and processed through Provider Network Management. The Ohio Department of Medicaid has reference guides available to walk you through submitting your application. Please view this document for step-by-step instructions. To access the reference guide, visit the Ohio Department of Medicaid website. Click on Resources for Providers, select Provider Network Management, and then click on Reference Guides. The guide is called Individual Practitioner under the User Guides section. Additional resources to assist you with completing the application are available on our website at www.ohiohcbs.pcgus.com. You can select Future Provider at the top of the page and then Provider Enrollment to view the enrollment application guide for independent providers. Our team is available to answer questions about the application process and provide requirements at 1-877-908-1746, Monday through Friday, 7:30 a.m. to 5:30 p.m. For details related to any of the Ohio administrative codes referenced in this presentation, please visit codes.ohio.gov. These codes reference the non-agency provider types reviewed in this presentation. Personal care aid requirements, code 5160-46-04. Home care attendant requirements, code 5160-44-27. Waiver nursing requirements, code 5160-44-22.